This is Ian, just a real quick breakdown to hopefully get you comfortable with transvenous pacers. It's real simple, just keep it real simple, keep it sterile. So just a real quick breakdown, maybe you'll be pacing them, transcutaneous over there. The doctor's gonna set up bedside, sometimes the ED doc, the cardiologist will do it. Just keep it sterile, he'll tell you everything he needs. Everything should be in this kit right here, in the pacer box, which is right here. And you can do this procedure in any room. This is all the stuff, this is everything that you should have inside a pacer kit. This kit here might fit different sizes, and that just got like all of this kind of in there, with the exception of these aren't in there. Sterile, throw it there, open it up, and the doctor will pick and choose what he needs, when he needs, and how he needs it. Hospitals do it different, some doctors do it different. But you gotta have, this is for us here, we just prefer the mini stick, and this is a certain gauge and a certain depth, and that's so everything can pass through this catheter easily. So you'll throw this on the table, or on the mouse stand, keep it sterile. It's a mini stick, throw that on the stand right there. This is the sheath that they use, it's a Terumo Pinnacle 6 French. Some like to use different sizes. This right there, between that where the sheath and the wire to advance or to pull back and all like that, because you're going in and out, you have to keep it sterile. That's if you lose capture. This is just a little sterile sheath. It's like a little Abbott Medical sheath, sterile sheath that we throw on there. Keep that sterile, throw that on there. This is gonna be your pacer wire. Throw that on the sterile field there. Bloop, that on there. And then once that's on there, to carry the power from the pacer box to the person, these are 8-amp 2000s. These are all over upstairs in cath lab. Again, if you need any of this stuff, you just call cath lab. And so this is the thing, keep that sterile, throw that on the field there. That's gonna be the dressing kit, just throw that on the field there. And then they throw you the 8-amp 2000, the male receiver goes into here. Boom, there you go. And so when the doctor hands this to you here, the little male adapter, little black piece, make sure you just pop it in. There's 2 sides here. Just pop it into the one that you're controlling, and you're gonna be controlling the ventricle. Pop it in there. Make sure you got your V. Ventricle. That's what you're pacing, because if you throw it into the atrium and you're pacing there, you're not gonna get anything, so. He'll ask for certain things. If he doesn't have it, then you can just call cath lab or the Rapid for supplies. And then, yeah, just keep it sterile. The pacer is real simple. If you've never done it, when you turn it on, don't even worry about this stuff on the bottom, because that has to do with sensing and pacing, and whether it's dual or single chamber. Don't worry about that stuff. It just defaults to doing the ventricle, or just one chamber, whatever. But you'll turn it on. This little sucker here. It's nice after you get them pacing, or whatever. Just hang it up on that piece up there. This will go with the patient. Throw it under the bed or whatever. They'll go up with it. You don't want to lose this or whatever. You can swap out the batteries when you get this. They're just gonna be right in here. You just push that, boop, pops out. Throw in some new batteries so they're fresh. They're new batteries. These little dials right here, that's for the rate. The top one's the rate, second one's milliamps, and these 2 are both the milliamps. And whether it's gonna be atrial or ventricular, we're just pacing one. So just go down on the A rate, down to 0. Doctor throws it in. He'll just set the rate. He'll say 80, 70, 100, whatever it is, and you can go up, you can go down, whatever the doctor wants. If you can't tell if they're pacing, but you're pretty sure, just go up to 100 or go whatever, and then you'll see it. And then that's the milliamps. That's the threshold that you got. So if they got good capture, or it's a good placement, then you'll get it at 10, and then you just dial down, and you watch with the doctor when you lose capture. So you 10, 9, 8, 7, 6, 5, 4, 3, and you lose it. Oh, we lost it at 2.5. And they're like, okay, go up to 4, or go up to 5. But if you lose that 2.5 or whatever, you had it all the way down, that's good capture. So it's good placement. So you're in a good spot. So once you're at that, then you know the depth of how far that's hanging out. And so that way you know at that depth, at the rate of 84 or whatever it's set up, and you got capture at 2.5. Check a pulse, squeeze a blood pressure, keep it sterile. You can hook up to the sheath that you have, which is hanging out of the pacer part right there. You can hook up fluids, but just keep it slow, super slow. You're not infusing fluids, you're just keeping it because you don't want clots to happen at the distal portion of where that sits. Sometimes it happens, sometimes it doesn't, but you want to do everything you can to prevent that from happening. So, if you ever have any concerns about placement, if it's moved or whatever, take a blood pressure, palpate pulses, keep it sterile. Sometimes it'll, when they just sit them up to do a chest x-ray, you'll lose it. Sometimes if they roll, you lose it. Sometimes if you scoot them off to a CT table, you lose it. So that's why it's essential to know how deep it is and what milliamps you got it and what the rate is and all that stuff. It's pretty straightforward.